I think one of the things that I've really valued here is how much our personalized approach also includes how personally people are embraced when they come to the James.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and today our guest is Dr. Kimryn Rathmell, the CEO of the Ohio State University Comprehensive Cancer Center and the James Cancer Hospital. Prior to coming to Ohio State in May of 2025, Kim was the director of the prestigious National Cancer Institute, and before that, she was the chair of the Department of Medicine at Vanderbilt University. We'll talk to her about her impressive career as a kidney cancer expert, her decision to come to Ohio State, and her plans to help the Comprehensive Cancer Center and the James continue to grow, innovate, and be a leader in creating a cancer-free world. Welcome to the podcast.
Thank you. It's a pleasure to be here.
And welcome. It's a little delayed welcome, but welcome to Columbus and the James.
Oh, thank you. It's been a tremendous start, and I've really enjoyed my onboarding and getting to know everyone at Ohio State.
Yes, I've heard good things. But first, let's talk a little bit about your background. And several times, many times on the podcast, people have mentioned the NCI. They've received grants and things like that. What exactly is the role of the NCI, and what does the leader, the director of the NCI, do?
Yeah, the National Cancer Institute is, so first, it's the biggest funder of cancer research in the world. It's a major component of the National Institutes of Health and has a unique position in all of biomedical research. That actually stems back to the National Cancer Act, which set the National Cancer Institute apart to really take on the war on cancer. It established
that goes back to the 60s, right?
Early 70s.
Early 70s.
Early 70s, yeah, in the Nixon administration, and set the NCI director as an appointee of the White House with direct report to the president, working very closely arm in arm with HHS to really make big changes for cancer. And so that comes with a lot of responsibility, and it is an incredible workspace. The NCI is funded with about $7.2 billion per year currently from the federal government, with the mandate to use that funding to make the fastest, most important, most impactful progress possible. It's identifying where those funds can make the biggest difference. It funds everything from major clinical trials groups that span the entire nation, really the largest network of clinical research that exists in any part of the world for any disease. It also is a massive grants program that funds everything from individual investigators and trainees to large groups who work together collaboratively. It funds the NCI designated Comprehensive Cancer Program or Cancer Center Program. That's a network of large organizations that are dedicated to making a big difference for cancer from foundational research all the way through to clinical. The Cancer Center designation is a mark of capability to be able to deliver on research that meets the needs of your community. All cancer centers have our terminology is a catchment area. So what is the region for which we're looking at what the incidence is for cancer, how cancers are being treated, what are the outcomes for cancer. For us, we're a state institution. Ours is the state of Ohio. And so
it even extends further, though, from what I've heard.
Oh, absolutely. Yeah. Our work extends far further.
Appalachia and surrounding states.
Yeah. Because we're one of the largest of the cancer centers, and because we have some of the most cutting-edge clinical trials, people come from all over the country, literally all 50 states, and from all over the world to have access to our services.
Some other people have talked about how research has shown that outcomes are a little better at comprehensive cancer centers because of all the things you just said.
That's right. There's a lot of data trying to look at where patients have some of their better outcomes, and there are good data that you can have better outcomes when you have access to the latest technologies and treatments. And really importantly, in part of that comprehensiveness is the ability to provide good supportive care to, in addition to the chemotherapy and excellent surgery that we provide, also we have an incredibly good nutrition support
Right.
services and people to provide good counseling and all the other components that go into a good outcome so that people can get the treatment they need in the time that's right and get back onto a healthy life.
So, as the head of the NCI, you were very much aware of Ohio State Comprehensive Cancer Center and the James. So,
Hmm.
what was your, while you were in that role, even
Hmm.
before you left, what did you know about us here?
So I knew before that Ohio State and the James was a really high impact organization. I knew several of the leaders here. Many of them served on our various advisory boards, and so these are advisory boards that have 12 or 20 people on them. There's always somebody from the Ohio State University represented there, so that Ohio State is really on the map in these spaces.
One of the things I thought of as you were talking about how somehow it's different in every comprehensive cancer center, how rare is it that the James is also very well connected with Nationwide Children's
Mm.
Hospital? Is that a fairly common thing or not?
That's another way that they all have a little bit of uniqueness. I think that's actually a real strength for us is that we have Nationwide Children's Hospital, which is one of the best children's
Right.
hospitals in the country, right here in town and very enmeshed. The faculty at Nationwide Children's are faculty of Ohio State. The cancer researchers there are members of the Cancer Center. So we're really seamlessly integrated when it comes to cancer, even though we work at two different organizations. And so we actually have some of the real sort of power behind each organization. It makes us together even more powerful. So I couldn't be happier than what we have with the relationship with Nationwide Children's.
So after everything you just said, I mean, I don't even think I need to ask you why you came here.
Yeah. Yeah.
But really, I think I will.
Mhm.
So when you did leave the NCI,
Mhm.
I'm sure you had a lot of options and people wanted to talk to you. What was the decisive thing that made you say, I'm going to come here?
Well, there wasn't one decisive thing. There were a multitude of things that came together that just made it easily clear that this is the place that was right for me. So first, coming from the NCI, where you have this very large view and you have the opportunity to work from everything from the the big picture of where cancers are moving in um, the evolution of our cancer experience, and you see the foundational breakthrough science. I mean, you really have like everything. I was looking for a place where that was still true, where I could still work in all those spaces.
When you say all the spaces, you
Yeah,
mean everything from the bench
literally
to the
everything.
bedside, every area of research, every area of
Yeah,
treatment, every area of everything.
yeah. If I can go back to my time at the NCI, one of the things that I learned is that the power that we have to make a big difference is because there are all these different ways of looking at cancer. And it's when you cross fertilize that you can make the synergy that can bring something really magical forward. And so, when immunology of cancer, touches some um, uh, research that is looking at a particular population, all of a sudden you realize, oh, here's an opportunity where we can move and go forward. The it's having all of that and then looking for places where there's cross fertilization from basic science into clinical research, the epidemiology of cancer, population science. That's where we can make a big difference. You have to have it all. And so that was what I wanted, someplace where I could continue to play in all of those different areas. And that that brought me here. That was the big one. This is a place that can make a difference in lots of different ways.
But it's interesting when as you were saying that, I'm thinking to bring all those things together, you need a leader
Mhm.
who can set up a system to see those similarities and crossovers and bring them together. And
Mhm.
that's I think at the NCI and here, that's one of your biggest challenges I get and opportunities is to see where you can create collaboration.
Yeah, I think you said it exactly right. It's a challenge, but it's mostly an opportunity. And I think I've been fortunate by the fact that I am a basic scientist. I am also a clinician. I've also had a lot of experience in administration, and then I've had this, incredible opportunity to create a network around the cancer community and to see all of the. I'm certainly not all, but as much as I can of the cancer continuum in space. And so, that it does take a fluency in all of those different areas to be able to bring people together. But that's what I love doing most.
Yeah,
I really like bringing people together.
Seeing the big picture is a skill.
Yeah, well, and it's really, I find that very, very fun. I'll say there are a couple other things that made the James really very clearly the place I wanted to come. One is, in addition to that high level, want to be a part of everything, I also really like having my feet on the ground. I really like being able to interact with students, to be able to talk directly with patients, to have a good chance to communicate in the community. And in some of those kinds of spaces, you can't do that. It's just not possible. But here it's absolutely possible. And I get that chance on a daily basis to interact in that way. So I like kind of going from the top level, like right down to where are we on the ground and how are things going, just to see and have that taste of it. And then the other is when I realized how much community support there is for the James. That just blew me away. I met with community members on my very first visit who were really supportive of this recruitment, who were very clearly had been engaged for a long time in how the success of the James came to be. That was really special.
See, I've noticed that too, and I know that Peloton is a big part of that, but it even started before then. And is that, and Peloton really accelerated it, but is that rare? Do other places, I know every place has some community support, but are we here at the kind of top of the totem pole?
Yeah, I think that this area, is special. People care about cancer, and everywhere that I've ever gone, I've seen people want cancer research to be successful. They want a cancer center to succeed. That's hands down, that's true. But what I find different here is how many people are very proactively engaged in the success of the James and of cancer research, and who really want to get to know cancer researchers and understand what they're doing and support them in whatever way they can. I think you're right. That community was here before. That's how the James came to be.
Yeah, that's the history.
But then as Pelotonia came along, I think that also really almost democratized that. Like everyone in the community can be a part of it, and that's the other thing that I saw when I came here. In addition to the people who were, sort of actively meeting with me as I was looking at the James, was you meet people at the hotel and in the restaurants and in the taxi, and I had innumerable conversations with people who would say, I know about the James. My family member was treated at the James. They had a wonderful experience. We're so proud that this is a part of our community. And then often would say, and I ride in Pelotonia, or I've been a part of Pelotonia, and I'm proud that our community can come together and support something like cancer research. That I have never seen anywhere before, and it's really, really, it's special. It's inspirational.
Now, just in case anyone's listening for the first time, Peloton is an annual bike ride that thousands of people ride and volunteer, and it's raised, help me with the number, it's over 350 million?
Yeah, it's approaching 340 million.
340 million.
Yep.
Okay. So, everyone involved now feels a part of the James.
Absolutely. And that kind of fundraising allows the James and the OSU Comprehensive Cancer Center to be really forward thinking, to be able to do new or different kinds of research that might not have been immediately funded by the NCI. The NCI, as large and as impactful as it is in funding cancer research, has limits,
Uh,
and we really can't fund everything.
oh, that's a great point because so many people have talked about Pelotonia funds seed grants
Hmm.
that creates the data that leads to bigger NCI grants. And
Yep.
was that true?
Oh, it's
Yeah. So
absolutely
that,
true.
yeah.
Yeah, it
And
both brings people together to do larger work at the NCI. It allows people to get that first data, or that's first proof that their
right.
hypothesis is on track. You know, the NCI and the NIH really want to fund high risk research, but they get so many grants. During my time at the NCI, we were only able to fund 9%. So, fewer than 1 in 10 grants
Wow.
that went in could get funded, right? Way more than 1 in 10 are great research, impactful things that we would love to have funded. So, in order to get into that 1 in 10, you've got to have, some evidence that what you're doing is really likely to be successful. So, this kind of that seed funding allows people to get that, do those first experiments, get that proof going, demonstrate that I've had a hypothesis, I am on the right track. Now my hypothesis is more mature. Now I really know where I'm going to go, and here's where we're going to take this research.
Yeah, your
So,
data
yeah.
supports your hypothesis, and then you're ready for
Yep.
the
And
bigger
then
study.
you're much more likely to get funded.
All right. Well, that was great.
Okay.
And we're all very happy you came here.
Okay.
And we're going to take a quick break. And when we come back, we're going to talk about your plans for how you're going to help the James and the Comprehensive Cancer Center continue to grow.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back with Kimryn Rathmell, the new CEO of the Comprehensive Cancer Center and the James. So you have a big job ahead of you. And what are your plans? What are some of the big areas or opportunities? What are your plans for the next few years?
Well, first, it's really thrilling to jump on a train that's really running already. The James has been firing on all cylinders for a while. That doesn't mean we're not going to do new things,
Right.
but I just have to brag about it for just a second. I came in May. In June, they did their site visit for the renewal of the cancer center. So that really was, work that long predated me, and they just knocked it out of the park. So
Well, explain what that is, the renewal of the cancer center.
Yeah, so these cancer centers are really valuable. They're
Comprehensive cancer
the
centers.
comprehensive cancer centers from
designated by the NCI.
Yes, you know our lingo. They are charged with really delivering this exceptional level of care, but they're also judged. And so every 5 years or so, and it's 5 years unless you have an exceptional score, then you can get an extension to 7. You have to do a complete audit, essentially, of all of the work that you've done, prepare a completely new proposal, and then they come and visit you and see if you are delivering on this service to the nation. And no pressure there at all, right? And so we just completed that process, and we got an exceptional score. Exceptional is as good as the scores get, and we scored in the exceptional. So
I've seen the booklet that you have to prepare. It's like
It's
1,000 or more pages.
It's like 2,000 pages.
Oh, it's grown.
Yes,
It's
yes.
2,000. So,
It's massive.
and wow. And the NCI is the
Mhm.
one that grades it.
That's right.
Okay.
Right.
So you
Yeah.
came here in the midst of that, which
Yep.
means the James and the CCC was in great shape,
Yep.
which is always good.
That's right. I did not come to a fixer-upper by
Right.
any means. But I will say the landscape is changing really fast. Healthcare is moving, and the kinds of opportunities that there are to make cancer a disease that's controllable, that we can cure with increasing confidence, and that we can prevent in many more cases. That is where there's just opportunity in all kinds of directions. And so we really have to be able to prioritize, like, where are we going to have our biggest level of impact? So, we're taking on some of the things that have long been strengths here. Really personalized care is something that we do quite well here already. And personalized means everything from really having an expert for a specific type of cancer, including down to the rarest of the rare tumors, but having the advanced treatments, having clinical research that addresses those harder topics, as well as research that brings us to treatments that are less toxic and more effective for our more common cancers, right? So we've got that kind of personalized approach already built in. I think one of the things that I've really valued here is how much our personalized approach also includes how personally people are embraced when they come to the James. That's evident when you walk in the door. The people who greet you are there and ready to help in literally any way, and that kind of service, very personalized, takes its way all the way through. It was actually seeing that made me realize that personalized approaches are where we can double down. And so we'll be really looking more. Every cancer is becoming a rare cancer. We're good at that. We can do that even better. Every person.
When you say every cancer is a rare cancer, the lung cancer is not rare, but there's like 800 kinds of rare.
Exactly.
Okay.
Exactly. That's a perfect example. So we have cancers that were previously lumped for lack of any better way of separating them out. But as we learn about the variation in the genetics of those cancers or other factors about a patient's cancer that makes theirs different from another, we learn how to take care of each one a little bit better.
So when you say personalized cancer care, does the term precision cancer care sort of overlap with that?
It does. And those two terms have been used interchangeably for a very long time. I'm intentionally using the word personalized because I think of precision as encapsulating the cancer diagnosis, right? So we will have the right treatment for that cancer. Personalized means for the right patient. Like, to me, that means we get to what they need at this point in their life or in their cancer journey, or with regard to where they live. So precision cancer is more about diagnosis and treatment. Personalized is about the entire spectrum of care. Yes, yeah.
So
it's about the person.
Yeah.
So that's how I'm using it, and that's where we'll be putting a lot of effort. I think an example of how that kind of an effort plays out is an initiative that we just launched a couple of months ago called the Bridge Program. And the Bridge Program is addressing an important facet of cancer, which is this rise in cancers in people under the age of 50, for lack of a better definition. So we've been recognizing this for 10 or more years, that for example, colon cancer has had a lot of press that
just 2 days ago, James Van Der Beek, the actor, passed away from
exactly.
that. Yeah, and he was 40.
He was in his 40s. Yeah. So it's now on people's radar that cancers that we previously used to think about as predominantly in your 60s or 70s, showing up when you're in your 30s or 40s. I mean, that's it. It's heartbreaking, and it also isn't something that we really can't ignore. And so there are at least 17 different cancers that are rising at that kind of a rate in younger people. Some of them are rising more in young people than in older people. Some are rising across the board, but still we're seeing increased rates in young people.
That's right, isn't it? And colon cancer is that example because of colonoscopies for people 45 and up. The rate is going down because they catch the precancerous polyps, but people younger
that's exactly
aren't getting the colonoscopies yet.
That's exactly right.
Wow, so
yeah. So seeing this and recognizing, one, we don't know why this is happening. We don't know what the convergence of environmental factors or lifestyle behaviors are contributing. It's probably multifactorial. It's probably different things for different diseases, but we need a way to be able to look at that. But we also need to make sure that we're offering this segment of patients the services that they really need most. And so the Bridge program is actually starting with things that are impactful for any cancer across those spaces. So a patient with a colon cancer, for example, will still see a colon and cancer expert. This is not another clinic. They will see someone who has an interest in younger adults with cancer, but who is a card-carrying colon cancer person. But across the board, there are issues around fertility and issues around financial toxicity that are different for people who are younger than for people who are in the Medicare age range, for example. And so having the savviness for our financial counselors to be able to provide the kinds of information that people really need to be able to get through a cancer diagnosis is incredibly important. So that's where this is starting. Again, that's personalized care, right? It's personalized to that specific need.
Okay. We just did a podcast on the Bridge program a
Yes,
couple episodes
good.
ago, so
Yeah.
people can learn more. What will be another area or new program you're starting?
So we're going to probably start a lot of new programs and bolster ones that are already very effective. Because I already mentioned the early onset cancer, we're not at all trying to forget older patients with cancer. So we have a longstanding oncogeriatrics program. So focusing on the elderly with cancer. That's a tremendously valuable program that that we're working together with to try to expand its impact and make sure that it's really reaching the patient population that it needs to. Setting aside those 20 and 30-year-olds, you think about if somebody is in their 80s with a diagnosis of cancer who might have other medical problems on top, might have issues with mobility or balance, might have issues that affect hearing in a different way than they do younger people. That program is addressing those kinds of issues, right? So we're working with them as well to help them grow. So it's not only about age. I'll also say
So it's about all ages.
It's about all ages, exactly. So other programs that we're launching. One I'm really excited about because it'll touch everything. Is we just started an initiative around innovation. So we're a creative group of people. Curiosity is absolutely something that is in our blood, and we come to a field like this because we want to be innovative, right? But the opportunities for innovation can sometimes require sort of an additional boost. And so we're starting an innovation center and brought in a leader who comes from the startup world with background in software engineering, as well as working in the not-for-profit space with foundations around rare cancer types. So this particular leader is going to help us really bring a different level of synergistic innovation that can take any program into sort of the next level. I see innovation as a component that we need both in research, but also in care delivery and in the nuts and bolts of the work that we do to provide good cancer care for our patients. But I think that the Innovation Center will also just provide frameworks that allow people to step in and bring their innovation forward so that it can be most effective.
So in a sense, there's the Drug Institute that helps people create new drug treatments. This will be similar in different kinds of innovations.
Right, exactly. I mean, thinking about how we bring forward innovations with AI. I mean, that's always, an example to turn to because there's so much there. And how can, people really harness AI to address whatever problem they're seeing in their patient group, in their clinical arena, or in their research space, right? So being able to build those connections so that we can take, what we can do with AI and just do really like out of the box, exciting things. I'm really excited to see what we can do, and it's been just fascinating, even in the few weeks that this center is kind of beginning to come to life, how it helps people really proactively think about, well, what about this? And, could we, for example, learn from every patient who has a particular set of symptoms to be able to predict those in the future? Could AI give us that kind of knowledge of patterns that we can't see as mere mortals?
Yeah, so it can analyze billions of bits of
Yeah.
data that a human brain, one person can't.
Yeah.
Wow, I hadn't
Yeah.
thought of it because I know you're using AI to like look at mammograms and
Yeah.
other kinds of digital kind of things. But wow, just patterns.
Right. AI can do, there's a lot of different things that it can do, but one of the things that it can do really well is find patterns. And patterns is often what we need to be able to, recognize, something that's different, or something that's a biomarker, or a piece of evidence for us.
Okay, so the Innovation Center is up and running and is going to
Yep.
grow. What would be another
Oh,
area?
goodness.
Well, one
I've
thing
been here for 8 months.
One
Yeah.
thing I've noticed in the past couple of years is new facilities, a beautiful outpatient campus or outpatient facility
Mhm.
on the west side of campus
Yep.
that you're trying to meet people where they live, it seems like.
Yep. So that's a really good prompt, because I'm going to answer that in a couple of different ways. So first, the demand for our services really has exploded, and we're here to really meet that demand. Some of that growth has put us in a really good position. The growth on West Campus is a great example. The James Outpatient Center is fully online, really meeting the needs of groups of patients. But we know we have patients who are, in our near suburbs, who also are looking for our services. We'll be opening in Powell this summer. Really excited about that, to have our first bigger footprint in that region.
What will that facility be like in Powell?
So our brand is specialty care. And so we'll continue to be specialists in every place that we move outside. And so we'll have several groups of specialists who will move out to Powell.
Specialists in different
in
types
a particular
of cancer.
type of cancer. Yes. And so we'll be advertising for that to make sure that people know what those services are that are available out there, and to know with confidence that the care that we deliver at Powell will be exactly the same quality that we would get here at the James or James Outpatient Center or the Spielman. We'll make sure that we're all very integrated and connected.
We just did a podcast with Electra Pasquette, an epidemiologist, who talked about some of the programs she's doing for underserved populations throughout the state. And I understand that's a big area of interest and concern for you as well.
Yeah, it is. I'll take it one step back to my time at the NCI. And one of the things that we saw was that in some cases, the incidence of cancers were higher in areas that were designated as rural or otherwise underserved, as well as outcomes not being as good. We had the opportunity at the NCI to do a pretty big tour of the Midwest and observe what kind of opportunities there are to try to reach rural communities in particular. And that really moved me a lot. So I grew up in rural Iowa, and saw what it was like to be 4 hours from any major academic center, and so I'm really sympathetic to meeting needs in those communities, as well as I think if we want to make big difference for cancer outcomes for our nation, we have to be able to provide services that meet needs of people who live in any community. Okay, so the work Electra Pasquette has been doing for decades is by far and away the most innovative, the most creative, the most impactful that anywhere in the country. we started this podcast like, what had I heard about Ohio State? Electra Pasquette is one of those names, right, that rolls off everyone's tongue for the work that she does in Appalachia and in underserved communities. So I am really passionate about trying to find ways that we can use Ohio State and the state of Ohio as a role model for how to deliver care that meets communities where they are. We have a lot of different initiatives that are already tapping into that. Many, it sounds like you talked about with Electra and her work in Appalachia. We've also been really thinking about how, the best cancer is a cancer you never have, or a cancer that you detect very early and manage. And so that's prevention and early detection methods. If individuals who live in rural communities don't have that kind of access, we can't expect improvements. And so the implementation of things like our lung screening van brings lung cancer screening to people where they live in a way that is accessible, easy, and can allow us to hopefully reduce deaths from lung cancer in our state.
Right. You're going to areas.
So I'm really excited about that work.
Yeah, you're going to areas where the percentage of smokers is high.
Exactly.
And the facilities are low.
Yeah.
Wow.
But two other things that we're doing that I want to make sure people are aware of. Number one, we have the James Cancer Network, which is a series of hospitals that we have partnership with. We don't own these hospitals. We work together arm in arm to provide services that are unmet needs in those communities and to be ready partners for access to our clinical trials and to be able to make services available to patients in communities and to enable patients to get the care that they should be getting at home. So we're really working on trying to make those partnerships be very bidirectional. And then the other thing that we're doing, related but different, is really thinking about how this is 2026. Like, how do we use technology to our advantage? We all order things online and they appear within 48 hours on our doorsteps. We all use various ways of telecommunication to interact with people. So why can't we do that in our work? And we're pioneering one clinical trial that looks at a very rare subset of pancreatic cancer, and it identifies individuals based on their genetics of their tumor. If they're eligible, they can be consented by telehealth. So they're a patient of the James, but never have to travel here. The drug that we'd like to test is oral. It's a pill. It can be shipped, and it's mailed to the patient in their home, and the rest of the care is delivered with their local doctor. It's a totally different model, and I think can make access to some of the newest thoughts in cancer research really accessible to anyone.
Yeah, we, of course,
you've done that?
We have done it with Smeek Roy Chowdhury.
Yep.
We have done a podcast with that, and it is a pretty amazing program and perhaps and hopefully a national model that he and you are creating.
Exactly. I think it's game changing. I think it really can set the standard for how we do clinical research.
So you've just listed several tremendous opportunities and challenges. As the leader, how do you make all these things happen? How do you help people create all these great programs?
Yeah, there are first always more programs to do than we can in any given day. So we have to prioritize and do what we think can have the biggest impact or is the right choice at the right time. I'm very lucky to have a team of people who are really passionate, who really want to move things forward. So sort of enabling people to take on a complex project is really easy here. So I love that part. So, how do we get things moving? I like to build teams. I like to build teams that are cross-disciplinary, that bring people from different paths. Bring in, for if it's a clinical program, make sure nursing and pharmacy and social work is present. And so we can create a team that can come up with the best solution. These are the people on the ground who know what it is that we need at the process steps. Get them together, give them the resources and the time to be able to do the work, set up a timeline, and go. And people here have been really very, very receptive to the kinds of things that we're going to be able to do in the next 5 and 10 years. And then you have to have resources. So I know we're going to talk some about Pelotonia. We couldn't do this without some of the flexible resources that come from Pelotonia and from other sources of philanthropy. People really investing in the kind of work that we do here.
Sounds like you like to watch people succeed.
Oh, I do. That's the most fun part of these jobs.
Well, and let's talk about another fun part, which is Pelotonia.
Yep.
And from what I understand, you already were a bit of a cyclist when you came here. I think you rode your bike to work.
Yes. Yep. I really enjoy cycling.
It's a good way to de-stress.
It is. Yeah, it is. And it's it's a nice way before and after work as well to kind of be outside and enjoy a little bit of fresh air.
So I have been riding in Pelotonia for a long time, but I'm always curious for someone who rides for your first time.
Yeah.
You probably heard a lot about it, but no one can really explain it in words. So what was it like to ride that first time, to get there in the morning surrounded by all those people and set off?
Yeah, I think that is absolutely right. I was told that it would be an experience, unlike anything I'd had before, and I didn't really appreciate that. My husband is a marathon runner, so I've gone to lots of big races with lots of people and crowds and cheering and music and that kind of excitement. This was different. So it's different in a bunch of ways. I had not appreciated how emotional it is to see that wall where people write their tributes, or to see how many people are there really either supporting a loved one who has or had cancer, or who are coming because they were really touched by a cancer experience that was life-changing for them. I mean, that's not just 1 in 10 people. That's pretty much everybody who's there for the ride weekend, the riders and the support people. I had not come fully prepared for that experience, and then it does have a really incredible energy. I mean, people are really sort of happy. No one's nervous. It is not a race.
Right.
I really love that it's an experience that we do together, rather than worrying about how fast we finish or if we finish. It's everybody finishes and everybody has a great time.
And there are people along the side of the road cheering for us, which
yeah.
always shocks me.
Oh, and they're cheering, and they're all they bring different gadgets and gizmos, to noisemakers or signs or
Those
or
cowbells.
decorations. Yeah, and so seeing those groups, hearing those cheers, but especially seeing signs when they say, this is for my mom, and I really love the acknowledgement of survivors on the shirts of your riders, because it's passing the people on the road who are on the side, but also your fellow riders. And I'm a kind of a slow rider, so I got to ride with lots of different people. And
people are happy to talk to you.
They are. Yeah, I met all kinds of people.
And they didn't know who you were.
No.
Right.
No.
But they just, right.
Yeah. So I just talked to, lots of people riding for, family members, or had ridden for many years. And this was an important thing for them. I met a bunch of people who work here at the James, and who, were, so passionate about their work that it's important to them that on their day off, and we work people hard, people who go into healthcare work hard. And so when they have a day off, they're tired, and they took that day, to ride. And were happy and, really, sort of thrilled to tell me what they did. That actually was really powerful to me as well. And just the way the whole community comes together. And then you pull into the end, and so many people, there, to cheer you on. And
Where does the 25-mile ride end?
It ends in New Albany.
Oh, okay.
Yeah. Yeah.
So that's a big celebration in New Albany.
Yeah. Yeah. It was a nice big celebration, and people are, there to, just be happy that we can all be there, and that we can ride together. It's really special.
And it goes back to what you said about the community here. And I've always believed that in addition to the money, just as important is that connection and community. It's built between the James and the people who ride and volunteer.
Yeah, it is exactly. I think it kind of erases the us and them. We all want a world that's free from cancer, that we don't have to worry about a cancer diagnosis. I mean, the James long-standing vision to create a cancer-free world, right? That's what we all aspire to, and that we all do it together. That it really touches you, and I don't know that there's another way to make that kind of emotional connection outside of something like the Pelotonia. It's physically exerting. It's also many people together, but it's got an emotional ring to it that just isn't matched.
So I can hear the emotion and the passion in your voice, and I always like to ask people, where does this passion come from for you to really to go be above and beyond, to see patients, to do research, to do leadership positions, to come here to create new programs and impact and help more people? What drives you?
Yeah. How did I get here? So I think I'm probably a scientist first, and it was, realizing that there's not just a little bit more to learn out there. There's a lot. I love the discovery and the opportunity to find new things, right? To be able to do that in the setting of healthcare, brings for me, a really special level of significance. I mean, it makes that mission just abundantly clear. And then in doing those things, so first of all, I was marrying science and medicine, but I've always been a little bit of a blender. My PhD is in biophysics, right? Like, I'm a biology and physics person. I like to find the connections between spaces. And so being a connector kind of set me up probably to move into the administrative space. And I really like building things. And so when you can, build, train, and discover all in the same, and to do it in a way that makes healthcare different, that's really where you can feel really impactful. I didn't really appreciate all of the impact a person could have until I was at the NCI. And I don't think it's that there's sort of one person who can have an impact. From the NCI, you could see how an individual researcher was changing the way we thought about cancer, the way an individual clinician was, finding something, new that really makes a difference. Examples like, Samik Roy-Chowdhury's research, like one investigator saying, I'm going to try something bold and new, and it changes the whole field. And when at the NCI, you could see that everywhere, right? And so, I have, it's a great privilege to get to be leading the James and to be able to make those kinds of connections, but to be able to see lots and lots of people who are able to do that as well.
Well, I think they made a wise choice in bringing you here, and thank you for filling us in, and the best of luck going forward.
Thank you very much. It's been a pleasure.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.